The feeling of being overwhelmed or unable to cope with mental and emotional pressure is stress. Stress is our body's response to pressure. Many different situations or life events can cause stress. Sometimes this stress response can be useful. It can help us push through fear or pain. However, too much stress can cause negative effects. Long term, this can affect our physical and mental health. As per the result of large-scale survey conducted across India in 2019, young adults between the age of 20 and 29 years of both genders were the most stressed in the country. The major cause of high-level stress among young people are peer pressure, pressure to succeed in academics or work, and irregular routine. 50% of Indian professionals have reported that an uncertain future is their topmost source of stress, as was revealed in a recently concluded survey by the Seventh Fold, a boutique HR and well-being firm. Every year, the world celebrates International Stress Awareness Week from 1st to 5th November. This week encourages people to sit back, unwind, and embrace peace. Awareness about this become even more significant this year due to the tough times people across the world have gone through in the COVID-19 outbreak. We at Medicircle are conducting International Stress Awareness Week series wherein we will be featuring experts in this field to understand and create more awareness about the effects of stress. Hello, I'm Aprajita Mehra, and today our guest for the talk is Dr. Ashwini Kulkarni. Dr. Ashwini Kulkarni is a consultant psychiatrist at Pune. She is currently practicing at her own clinic, Advait Mindwin, and is also associated with I Am Fine Foundation Rehabilitation Center. She holds an experience of 12 years in depression and anxiety, psychosis, stress management, child and adolescence. She believes in counseling, giving sufficient time to patients and their family members. We welcome you to Medicircle, Dr. Ashwini Kulkarni. How are you today, ma'am?
Thank you so much. I'm doing very well. So I
Okay.
really appreciate your initiative and thank you for inviting me.
Absolutely our pleasure, ma'am. So, doctor, my first question to you quickly would be, what are the common causes of stress?
So as you have explained or in the introduction about stress, every individual is unique in the way they behave, the way they handle the situations. So whenever there are the body reactions to particular situation or the event is called as stress. So the stress, as mentioned, can be both positive and negative. The positive stress can be like pregnancy, getting a new job, promotions, getting new project, shifting to a new place. Of course, it sounds exciting, but there are certain adaptation and changes that happens in your body and in your emotional state. So that's a positive stress. Parallelly, there are negative stress like losing your loved ones, breakup issues, job loss, unemployment, where there are a lot of financial crisis coming in. So currently with this COVID-19, we also understand that uncertainty is something which it is really, we see predominantly, which brought a lot of helplessness among members, among people of every domain. And especially the stress is something when a person individually feels that things are out of their control. The person feels helpless to handle the situations. So that's the time when we call the word as stress. So it does not just individually have some particular age group. It can be from the, like currently I have even kids coming to me from, the school going kids, adolescents to adulthood and elderly. So it completely covers all the age groups who are currently going through the stressful situations.
So truly said, ma'am. This has become everyday norm for most of the people right away. So I would move on to my next question, which would be that when should a person seek professional help to deal with their stress?
Yes. So most important thing which we need to understand is when I say stress, and it definitely is going to affect you both physically, emotionally. It is going to affect you in your thought process, cognitively, in your performing. So the situations when it is, as I told, when things are getting out of control. So when your performance at work is getting affected, when you start realizing that you're not able to concentrate, your focus, there is a lot of distractions, there are a lot of overthinking that is happening even when you are working. Second is that definitely indirectly starts affecting your productivity at work, affects your confidence. And that is the time when you need to realize that, yes, my performance or my productivity, when it is getting affected, despite I having all those potentials within me. Next is in the relationship, when you're having a lot of mood swings internally because of the stressful situation, trying to deal with it all alone. But indirectly, what happens is after a period of time, it starts affecting people around you, your close people, the family members, your colleagues, your friends also start getting affected. So when the relationship starts getting affected around you, so that's the time when you need to really realize it. Physically, when there are certain damages that starts happening, like, start complaining constantly of headache, body ache, the sleep issues, when it's affecting your sleep, when there is, early morning awakening, or you're trying to sleep but there is, onset insomnia, which is called as, or your appetite is getting affected. You may binge eat to overcome the stress, when you are binge watching some series to, overcome the stressful situation. That's the time you need to really understand that, things, I'm not able to handle the stressful events around me. When there are stressors, and it has just been spiraling up for a longer period of time, which is called as a chronic stress. You're trying to deal with it all alone for a longer period of time, not sharing with anybody, not even with your friends,
Right.
family members, holding on to that set of emotion. Indirectly, again, you would end up having all those acidic issues, you don't have your physical health issues, and you end up going to a cardiologist, you go to a gastroenterologist. I have patients who come to me with a lot of files of different specialists, but the root cause, end of the day, is your underlying stressful situations, which you're trying to deal it with for more than 6 months or a year.
All right.
So I try to tell the patients that, if we could have identified, if we could have worked on this earlier, trying to communicate it, it would have been, you visiting to so many doctors or taking so many medications, trying it would have been actually, prevented. People also use alcohol, they start getting into drug use, start using the sleeping pills, trying to overcome, for a short period of time, thinking, this is going to give me a sense of relaxation. The thoughts get stopped. I can, deal with my situation. Again, it is very important that this is something for a short period of time. Currently, social media, or Netflix and binge watching a series are also one of the escape mechanism which people are finding out. But again, over a period of time, that is hampering your health physically, affecting your sleep, affecting your performance the next day. So
Right.
when things are out of control, like use of drugs, that's the time again you need to visit your therapist. One important thing is when you are confused in certain situations, when you need a third person's perspective, when you need to go and talk out to somebody where you know that this person will not judge me, will not criticize me, but will listen to me. And currently, I understand most of the mental health issues. Whenever I talk to my patients, I understand is listening is something which is really important, listening without judging them. Because everybody really wants to jump out and give them the solution, want to help them. Yes, we all understand that you want to help, but again, each individual will have their own struggles, their own adaptability changes. So we need to give that time. So when you want a third person's perspective, when you're confused in your life, you can reach your therapist. Very important factor is when you start feeling hopeless in your life, when you think nothing is moving ahead, the future is dark, you feel worthless, helpless within you, and you also start contemplating, you start getting suicidal thoughts, self-harm thoughts. It is very important you share with your closed ones, and reaching out to for a professional help is something very important. It is very, I actually appreciate this initiative because stigma is something extremely common. People do not reach out to psychiatrists or psychologists so easily. They would want to fight it alone. Physical health, yes, they are openly to discuss that I'm having a headache, or they'll try to cover up with something. But when talking about the mental health, emotional health issues, somewhere they link it to their loss of willpower, or they being weak, or now they're not able to deal with things, so I don't know how people are going to judge me, what they're going to think about me. So it is very important that we share at the right time, seek help at the right time, so that this part of stigma is also, we are able to, break up and help people at the right time.
Wow, that was very well explained, ma'am. And in fact, it covered everything possible, a scenario for, seeking such kind of help. So what exactly are the types of professional help available to deal with the stress? Now that we are aware that we are going through with it, where should we seek help and where should we go?
See, me being a psychiatrist, I would definitely say whenever you're going through the stressful situations, we are a team like of psychiatrists and psychologists, so the mental health professionals, right? So when I say psychiatrists, we are doctors who have completed the MBBS and MD. So we do it both of, identifying the diagnosing the current condition, and the treatment is both the combination of medications and counseling sessions. And psychologists are the ones who are specialized in the counseling sessions, and they would work on a lot of therapy sessions, maybe something like cognitive behavioral therapy, rational emotive behavioral therapy, and different kind of behavioral therapies. So the treatment is also depends on the diagnosis. It depends on the staging, depends on the severity of the condition. It also depends on the people, like family history. If there is a strong family history, and if the duration of the illness is for a longer duration, we need to identify. So based on the severity of the illness, the duration, family history, the treatment works. And not the one more, the myth what people have is, anybody would talk of, I need to go and meet a psychiatrist, the first and foremost is, no, you go to them, they're going to give you a sleeping pill, you're going to get addicted to it, and that's the thing, you will be just lying down the whole day. But I would really want to use this initiative and spread this awareness that people reaching out to us, no, we do not just give them a sleeping pill, which is definitely a myth which we need to break. And rather we get people out of the addiction of the sleeping medication. There are so many who have been taking sleeping pill for so many years together, which was started one time by a physician many years ago, and just being continued for years together. So we in fact help them to get de-addicted from alcohol, from drugs, so which also includes sleeping pills. So definitely we do not put our patients on sleeping pills per se, but we definitely, the medications help in giving them a lot of positivity. Because as the physical condition is, we have certain blood tests, x-rays, MRIs, where you can actually see, okay, this level is less and I'm going to give this particular treatment, right? But in this condition of psychiatry, we do not have specific blood tests where we can say, listen, in your brain chemicals, the certain brain chemistry and neurochemicals like serotonin or dopamine, adrenaline is less, and this is a medication which will increase it. But when we start with this medication, it starts showing its effects gradually over a period of 3 or 4 weeks time. So again, I tell my patients, one, even when I'm starting the treatment, it's not like a painkiller, like I give you today and tomorrow you start feeling better out of it. No, give me 3-4 weeks, let it go gradually. Because you've been handling it, I understand the pain, but we need to give some time for the medicines to act, because it has to reach the brain to boost those serotonin, the neurochemicals, and only then you'll find the positive effects gradually. Again, these medicines are something where doctors, monitor based on the improvement, based on the developments, maybe at work, maybe in their sleep, maybe the relationship, where the family members also come and give a certain set of feedback. The medicines are tapered or increased accordingly. So it is not that everyone who ends up coming to us will immediately be started on medication. No, there are certain, depending on the severity, there is also just counseling sessions we do. like just like the situations, like, the stressful situations I said, told you, like acute stress or something, when they come to us, we don't start them immediately on medications. We listen to them, we give them time, allow them to talk, give them certain perspectives, they work on that. So that's how it works. So which we need to understand, their treatment is both the talk therapy and medication, depending on the severity, diagnosed by your doctor.
Absolutely. And I think that has actually given some insight and clarity into the situation where people feel that, going to a psychiatrist is such a, deal in itself. So I should suggest people that you should understand, you need to be resilient and patient with the doctor as well, that they are trying to make the best, use of the medications, trying to heal you. They are there to support you and help you in your struggle with the stress, and not exactly take advantage of you that you're there as a patient. So now that we've
Yeah,
spoken about
and
that,
one more
yes,
point to be mentioned here is the patients who are on BP medications or diabetic medications. If you stop
right.
taking it for a day, 2 or a week, you'll
Hmm.
find the BP getting, there are a lot of variations. The BP shoots up, your
Right.
diabetes sugar levels, they increase. Does that mean the person has got addicted to the BP medicine or diabetic medicine? No. Similarly, when you're going to stop a medicine abruptly at one time, there's a way we taper and stop it. But if they want to just stop it abruptly, you want to have those certain set of symptoms which is going to come back again. So that does
Right.
not
So true.
mean that
So
you're getting
true.
addicted to it.
So true that, like, that analogy actually works. Understand that. So
Yes.
that brings me to the last question of today's interview, and that is, so what are any lifestyle habits that can actually help reduce stress?
Yes. So, as I mentioned to you about the treatment of the medication and the therapy sessions, the lifestyle modification is something which I specifically mention to my patients, because that is really important, because miracles won't happen till you are also bringing certain set of changes in you. And the habits, the things which you are going to bring has to be something, be consistent, because when you are in your suffering phase or in the crisis mode, you're ready to go out, do anything to get better. But are you going to do it all your life? Are you going to do it something on a regular basis? Do you enjoy doing it, is something what I ask them. Because you need it to be consistent. If you're going to walk for 45 minutes, I would ask them, yes, you need to walk for 45 minutes at least from Monday to Friday, weekdays. Do not be like, today I'm going to walk for, 5 kilometers and 10 kilometers till I'm going to feel better. The moment you start feeling better, get that energy back, then again you come back to square one. So whenever I find patients coming with certain symptoms again, with no change in medication, no change in our other things, then I said, did you try bringing any other change? And they would gradually think and say, yeah, I decreased my meditation time. I decreased my, I said, changed my diet. I had a lot of junk or something like that. So that is something early warning signs which you need to identify, that when you stop caring about yourself.
Right.
And first and foremost is your diet, your appetite is something which is really important. And I would always appreciate and encourage to have something of a natural supplements rather than the artificial supplements of any proteins or anything. So go for natural sprouts, go for egg white, go for walnuts, anything which is going to give you rich protein supplement, which will definitely increase your positive neurochemicals like serotonin, dopamine, adrenaline. The endorphins get boosted, which is a positive neurochemical again, with a lot of cardio exercises, like brisk walk. And so when people are like, okay, I'll start going to gym. Again, gym, are you going to do it on a regular basis? I would be very happy if you do it. But along with that, I would encourage you have a part of cardio, and then you can go for your weight training. And then comes the meditation is something which people think that, before they reach out to us, they try it, right? They look into Google, they find certain ideas, try for the meditation. But I'm like,
Medication again. Yes.
meditation is something you're not going to be able to focus day one. It's again over a period of time. Maybe you'll take a month, 3 months, but gradually you'll develop a grip. Maybe for a minute. There's certain kinds like mindful meditation, guided imagery, which during our therapy sessions, depending on the individual, we would teach them. Then the most important, which we definitely identified in the COVID situation, was the social connectedness, where we We took it for granted, of connecting, talking, going out
Absolutely.
was something like we
Now
just
that
took
we
it
were
for
not
granted.
able to go and meet people, it suddenly hit us like it meant so much to us. Going out as
Exactly.
a social human being was so important. Absolutely.
Exactly. So to identify in the social connectedness as well, the relationship which is going to give you a lot of positivity, encouragement, motivation, yes, hold on to the relationship. The relationship which is giving you a lot of negativity, affecting you, pulling your confidence down, think about it, review, discuss about it, and work on that. There's no point in just working on it and then feeling guilty and bad about those kind of relationship. So it is very important, we need to filter the right relation, hold on to the right things, and the lifestyle modifications, which I definitely share with my patients.
Oh, that sums up so beautifully our complete interview, the importance of being a social animal, staying together with people, finding out all the best around you in terms of food, in terms of lifestyle, in terms of everything. As a wholesome, a development for an individual is so required. So whether be a pandemic time or otherwise, it is always required.
Absolutely.
So thank you
Yes.
so much, Doctor, for coming on our show and sharing your valuable time and your, amazing insights with us at Medicircle. It was really, great pleasure having you today. Thank you so much, ma'am.
Thank you so much. I really appreciate this initiative. And as I always mention to my patients, that when you're going through stress, you start identifying more strengths inside you, more positive qualities inside you, get more resilient, you're ready for tomorrow. So take it something more positively to deal, adapt, and get a positive change in your life. So thank you for this interview. Thank you so much.
Thank you. That was really a lovely message for all our audience. Thank you again.